Live with breast implant illness expert Candice Barley. I just need to add her here in a second. Bear with me. All right, we're gonna have Candice jump on. Let's see if she can get in. Candice is gonna tell me if she can jump on here in a second. I'm so excited for this conversation. So many of you have dropped in questions. Let's see. Let me know if you can jump in here, Candice. My connection is not great. As we all know, I live in the middle of nowhere. Okay, Candice, are you out there? Let's see. Let's see, Candice, where are you? So we are talking about basically piggybacking on that post I did. Hopefully by now you've caught the post on implants and saunas. Hi, my love.
Hi, how are you?
I'm good. Sorry for that. I'm technologically challenged, as we all know.
No, I've done these a few times, and every time it doesn't work the same. So
No, it's like every time I do one, I look at where the button was the last time. It's not there. They change it.
no.
So sorry for that. Sorry for that. So I was just saying that we're kind of piggybacking off of that post I did on implants and saunas, which has seemed to ruffle a few feathers and create some points of contention, really, because I think there's a lot of controversy around whether or not it's plausible that implants can actually melt in saunas. So I definitely want to get into that, but please tell my community who you are and all about you.
Okay, well, my name's Candice. I had breast implant illness. It's been 5 years now, so severely that my liver was essentially failing. I was scheduled for a liver biopsy. My liver enzymes were doubling and tripling every 4 weeks, and they could not figure out what was happening. I didn't drink alcohol. I ate all organic. I had full body tremors. I had debilitating fatigue, heart palpitations, hair loss, like so many symptoms. I was seeing so many doctors and no one knew what to do with me. And I started seeing functional doctors and they still didn't know what to do with me because on paper I was doing everything right, but my labs were getting worse and worse. And I truly had a divine intervention where I basically I still to this day can't explain it, but I heard breast implants and I started looking up, can breast implants make you sick? And then that was when everything made sense. And so I had explant surgery and had my liver enzymes tested 4 weeks later and they had reduced by half.
What?
Another 4 weeks later, and they were back to normal. The only thing I had done was remove my implants. I finally got into the endocrinologist that I had been trying to get in for 3 months, and she said she had to look at my blood work 3 times because it didn't make sense what it was at that point versus what it was when I had originally submitted my blood work. So that it looked like the blood work of a 90-year-old nursing home patient.
Wow.
And she said, "What did you do like 8 weeks ago?" And I said, "I had my breast implants removed." And she was like, yeah, like she didn't have a response because she was like, that
There's no
couldn't
way.
be it.
Yeah, there's no way is everyone's reaction,
Yeah.
right?
So, and I was seeing an endocrinologist because my thyroid was all of a sudden out of whack. So anyways, that led me down quite the path of really looking at all the other things that I was putting into my body, on my body, trying to really restore my health back to what I wanted it to be, what it hadn't been in so many years. And I had had my implants for over 17 years. And when I started looking at my timeline of when I first started experiencing symptoms, It was within 6 months of getting my breast implants.
Whoa.
So until finally I was bedridden 17 years later. It takes a long time. And I'd had ruptures and different things along the way. And all of this eventually led me to having a lot of information on this
Yeah.
subject. I was able to restore my health back to what it was before I even had implants in my 20s,
Yeah.
even better than what it was in my 20s. So, because then I was able to deep dive into my genetics and all
Sure.
the things that women should know before they are ever even offered implants.
Yes, that's the key, right?
Right. So I found out I'm a terrible detoxer. So,
Cheers.
yeah,
Cheers. Cheers.
exactly.
Cheers to poor drainage.
Exactly. So, I started sharing a lot about my journey, and I started having surgeons reach out to me and saying, "Hey, what? Well, you're saying this. What have you noticed about this?" Like actually coming to me for advice, and that eventually led to me working as a patient advocate for explant surgeons, and now I work privately as a patient advocate, leading women through the entire process from, what are you struggling with? What have you done? What testing have you done? Who have you seen? How do we find the right explant surgeon for you? And then post-op recovery and looking at what types of things that you should do to detox. There's a lot of misinformation about whether women should
Yes.
detox after getting explant surgery. Well, we know that everyone should detox. And you've had a stressor on your immune system for however long
Totally.
you've had implants. So you most definitely need some extra help after explant
Mhm.
surgery.
Definitely.
Yeah.
So that's so it's to me, it's like when you look in hindsight, and everyone's probably wondering, how do I even know Candice? So Candice was actually my advocate. So in 2020, the height of the madness of the world, I had realized that it was time for my 20-year-old saline implants to go. And at that time, you'd think, right? It's difficult to get surgery. But listen, people were willing. Anyone was willing. I started a journey of about, I'd say, nearly, not quite 24 consults. And it took me 3 years to actually commit. And this is why. One, I didn't have debilitating symptoms to where I was bedridden. I could no longer function. I couldn't take care of my children or perform my job. Mine started to become my symptoms started to manifest physically. So after two babies and nursing and doing all the things and my body not coming back, I started really having severe migrating joint pain, which is ironic, right? Because I'm married to a chiropractor. I'm board certified in chiropractic and natural medicine and nutrition. So I'm thinking, I got this. I'm gonna fix that migrating joint pain. I got all the tools. Not quite. So many doctors told me they're old. They're old. That they just need to come out. It's it. It wasn't until I connected with you, because having the functional medicine background that I did, that I actually was privy to the idea of an encapsulectomy. This was the first time I had heard this, because every single, that's 22 consults I did virtual, right? Between 2020 and
Yep.
2023. Every single doctor wanted to take out and replace. They said, you'll be
Yep.
deformed, two pieces of skin flapping in the wind. And I was like, oh, Jesus, Mary, Joseph. My husband loves me, so I'm lucky, but I wasn't, the vanity portion of that was not
Right.
appealing to me. And I also wasn't on board with this sort of cyclical surgery schedule that you're then put on,
Mm-hmm.
because then it's, we'll see you in 10, we'll see you in 10, we'll see you in 10, and just keep replacing them. And it's totally fine to keep doing that. I knew intuitively that that's not what I was interested in. So entwined with that, now everybody that follows me knows that I've been on this 2 decade plus hormone balance journey. And yes, after getting implants in the year 2000, I did notice that I started to experience what I thought was just the result of my work hard, play hard lifestyle, because I was not in healthcare at the time. I was in sales in New York City, and I was doing really crazy 80 to 90 hour weeks and traveling a lot. So I thought that it was a result of that, but the fatigue and the brain fog and the mood swings just felt like, well, this is what happens to you. You're busy. So many doctors just gave me antidepressants, and I was compliant until I started to put things together. Now, the long story of that is, prior to having my explant, I love a good full hormone panel. Everyone knows here I'm a huge fan of the Dutch test. Prior to that, I did have some markers on my Dutch. And then post explant surgery, my markers were like, okay, which didn't correlate to how I felt. And this is where I can't wait for you to elaborate on this, because I find that women go into an explant thinking it'll be this magic wand, because they're either not connected with the right person or in the right office that's giving them the knowledge that they need to really understand what happens when you're dealing with inflammation at that level for this amount of time,
Mm-hmm.
and how the liver is going to respond to that. I think
Right.
that conversation's lost, because we're going to wave the magic wand, take out the implants, everything's going to be fine. Now, I'm not saying that doesn't happen, because there's women on all these platforms, I hear their story, I'm like, wow, gosh, I wish that was me. But that's not. And I'm still on this journey, right? Because now we're about a year out from the actual explant, and I'm still struggling to manage inflammation. Granted, there's been trauma and other things in my life, but what I want you to expand on is what exactly is happening from an inflammatory standpoint when it's extended for that amount of time, and why does that have such a profound impact on how we feel?
Well, so all breast implant illness is chronic inflammation that is brought on by a foreign object. Your immune system is always trying to get rid of this foreign object. It forms a capsule around it. And as long as you have that going on, that's why it's so important to remove the capsule. Your body is always in fight or flight mode, essentially, for most people. And it starts out, acute inflammation is a good thing. It's, doing its job. But for most of us, that acute inflammation turns into chronic inflammation. And there's a lot of different factors. I feel like breast implant illness has really grown as an issue. It's not a fad, it's an issue because we are exposed to so many other chemical components, environmental toxins,
Yes.
glyphosates, plastics, all of these things that our body can no longer focus on or just manage the inflammation that's caused by implants that it could for many years without issue. Now, even in just the last 10 years, I've seen a huge spike with breast implant illness, and it's
Mm-hmm.
due to all the things that we're
Yeah.
exposed to. So,
It's almost just like it's bombarding your body's, working to protect you from the device,
right.
right? But then you're bombarded with so many environmental toxins, and your liver's left to make sense of it all.
Correct, right. And so then if you have other genetic issues with how well you're able to detox, via your liver and all of those issues, methylation, that makes those things that much more difficult. But what I explain it this way for a lot of women, that breast implants are the elephant in the room of your immune system, and it cannot focus on anything else until you remove that elephant. The other thing is inflammation, chronic inflammation basically begins to build a brick wall. And
Mm-hmm.
so women keep having to go up higher on their thyroid
Sure.
medication, on the supplements that they're doing. All of the things that they're doing don't seem to work. And it's really amazing because once you remove the implants, that brick wall starts to crumble, and suddenly all of the things that they're doing, or the thyroid medication, all those things become more bioavailable. And a lot of times they have to lower their thyroid medication within the first few weeks
Yeah.
because it's suddenly like just too strong. So it's inflammation just works like a brick wall, and
Yeah.
it's aging you. It's causing, joint pain is one of the main things that most women experience with implants. Is that's just inflammation,
Mm-hmm.
just inflammation 101.
Right. Yeah. So I definitely want to touch on, we've got so many good questions because I wanted to give everyone a chance to kind of, um, jump in their thoughts. A lot of women have DM'd me, and I think because there is a lot of shame surrounding possibly where they are now in life. I'm different than where I was when I got these things. I can't believe that they could be contributing to how I feel. So some of the DMs coming in before we get to implants and saunas, because that is such a
Oh
big
yeah.
topic. Some of the women want to know, please ask Candice why cost of explant surgery varies so greatly among physicians.
Yeah. So there's a few reasons for that. Sometimes it does come down to skill. There are some very highly skilled explant surgeons, and oftentimes I feel like a good way to look at price with certain surgeons are if there are surgeons that you don't see a lot of marketing going on, and then you have heard by word of mouth that this is a really good surgeon, and you find out that they have an 18-month waiting list and their price is really high. That usually comes down to they are amazing at doing explants and lifts at the same time. And because they're so highly skilled at that, and there's such they're sought out for that, that's why all of their prices in general are high. I do tell women that a high price does not necessarily mean a better surgeon. There is a lot of surgeons that are wanting to, they see where the business is, and so it's a more extensive surgery. That if they're still placing breast implants, they don't like doing proper explant surgery. They're going to charge more for that. But there are a number of excellent explant surgeons. All they do is explants. They're not out marketing themselves or all over Instagram, but they are very, very good at what they do, and they are a reasonable. Explant surgery is double what breast implants cost us. It just
Now,
is.
that's interesting.
Yeah,
It's kind of like you get a tattoo for $100, but removing it costs 3,000.
exactly. Exactly. So,
I would know about
yeah.
that.
And
All the things.
the reason that it is so expensive is because they can put your breast implants and have you in and out of surgery in an hour. Explant surgery is on average 2.5 hours. It requires special skill, special instruments for them to be able to fully remove the capsule from the rib surfaces, from the back of the breast tissue without taking without taking too much. I never know why it does these things. um, Without taking too much tissue. And then there's a lot of other steps, like they send things off for pathology to look for any malignancy. Many surgeons send things off for PCR testing to check for biofilms. And it's a more extensive recovery. There can be muscle repair, so that's why it's more expensive. But it's definitely something that you want to be have done right,
Mm.
and have done by someone who primarily just does explant surgery. Yeah.
Agreed, for sure. It's worth the research and the time because it's an eye-opening experience. That much I know. I definitely took my time. I'm glad that I did, and I'm glad that I found you. So another question is, a lot of women want to know, particularly if they are starting this research process, they want to know, like, is there one particular question they should ask? Is it a series of questions?
Yeah, it's a series of questions for sure. You want to, of course, know how long have they been performing explant surgery? Do they believe in breast implant illness? It's very important to have someone who listens to you, who says, and some surgeons, I mean, they still are scared. They're scared to like fully commit and say, oh yeah, implants cause these issues, and that's why I don't place them anymore, because then they're targeted by the associations,
Yeah.
the medical boards and associations. So you want someone who says, and I attend consults with some of my clients and with surgeons that I have worked with, and they still will say, I can't guarantee that this is going to, heal and get rid
Right.
of all of your symptoms. But it has been my experience that most of the women that have explant surgery do get better. So they just have to really skate the line. So that's the first thing is do they are they open to it? Do they believe you? Will they listen to you? Do they want to know about what symptoms you're experiencing and the as the symptoms resolve? Most do. Are they still placing breast implants?
Mhm.
Ideally, ideally they would not be. There's a few surgeons who do really great explant, still place breast implants, and I only recommend that to certain women who cannot travel and they're in their area, but I know they're going to have proper explant surgery. And first, and not first, but one of the most important questions are they performing on block total capsulectomies,
Mm.
which are they removing the entire capsule, ideally in one piece,
Right.
at the time of explant? Because
Mhm.
I have seen so many women who have had their implants out and left the capsule behind and their symptoms increase. And the reason for that is you have now opened up that scar capsule that's been protecting you from, biofilms, potentially chemical contaminants that have microleached and degraded from the shell. And once you do that, you're getting a release of that into the body,
Mhm.
and their symptoms just get worse and worse, and then they have to come back and do the entire surgery over again to remove the capsules. And
Then it's another surgery and the cost, and I mean, wow.
yes, and it costs this, it's cheaper to just get your implants removed, but you're going to
Of
have to
course.
most likely go back and get your capsules removed. And so it's going to cost you double. But those, I mean, I've seen some pretty amazing transformations from women who had had to go back and have a capsulectomy after they had their implants removed years ago.
Yeah.
It's been pretty
Yeah.
amazing. So definitely the capsules play a big part in this whole healing
I'm
process.
so glad that you mentioned that about the fact that surgeons, some don't remove the capsule, because even in my research, there were, like I said, how many consults I did.
Yeah.
I mean, there were surgeons that actually told me that that is not even a procedure. Like, I don't know where you even heard that, don't know where you saw that, but if somebody's doing that, that's actually not even a procedure. I was told that over and over, and I'm thinking, gosh, I heard it somewhere. Like,
No,
you
yeah.
know,
There are a certain amount of doctors, surgeons who really do not like women or patients who are educated and who have done their research, and they'll say stay off of Google. And if a doctor tells you to stay off of Google, find a different doctor.
right?
A doctor, this should be a process that you guys are working out together, and they should be glad that you are educating yourself and looking into these things so that you can ask the right questions. I did say someone asked, like, how do you know if they remove the capsules? This is another question that you want to ask before you have explant surgery is, will you film and show me pictures that you've removed the capsule at the time of surgery? So that's a very important part. And most all of these explant surgeons who are regularly performing explant surgery do actually show you, will film them cutting open the capsule and bringing the implant out and showing you the entirety of the capsule. And that's very
Yeah,
important.
that's so important. So let's dive in, because the amount of comments and questions surrounding body temperature, sauna, and implants is mind blowing. I went through every single one. So just literally, there were 80
Wow.
just on trying to challenge me that the internal body temperature doesn't rise enough to actually melt an implant capsule. I know that you medically assisted many implants, so I know that you've seen this before. So can you talk to the community about this, if it's, a misconception or not? Can daily sauna usage actually melt the capsule of an implant?
So there's ways to explain this without, this is an area that is, as you know, very hot.
Of
No
course.
pun intended, but
Yeah.
you can get in a
Well,
lot of
this is
trouble.
the trend. This is the trend, right? So we don't want to get banned from,
Right.
by saying the wrong thing, but this is a wellness tool. And I think this is
Yes.
important because when we're in perimenopause, and I know this from, I can't tell you how many patients I've dealt with now over 12 years doing this, okay? We will do anything, right? We are like not what we're doing in our 20s. We've turned a new leaf. We've gotten rid of toxic cosmetics and body products. We eat organic. We've got air doctors. We're doing all the things. And, you know, like really,
Right.
seriously.
And so many women have saunas now. And even the sauna companies, I've even had conversations with the sauna companies who are telling women that it's safe to get in the sauna
Wow.
with their implants. So one, never been studied. It has never been studied the effects of raising your body temperature with implants. Implants are meant to just stay at body temperature.
Right.
So we do know we're inducing a fever. On a macroscopic level. So when you look at the implant physically, will it look like it's melted? I have seen it.
Okay.
But it's not in the way like it degrades. It's slimy. It looks like there's some kind of goo on them, and it's been tested for different things. Nothing else. It's not biofilms. It's not any of those other things. Women who were getting in the sauna regularly and had mammograms and MRIs and all of these things looking for ruptures. Implants don't appear ruptured. They're ruptured and they're completely, the shell is completely degraded. Was that from the implant? I mean, from the sauna? There's
No
no
way.
study to prove that.
Right.
Where the proof is and where I believe that this can be addressed is in total toxicity tests. By doing total toxicity tests on women who are regularly doing sauna and who have extremely high levels of the exact chemical contaminants that are made in the implant shell. It doesn't matter whether the
Right.
implant is silicone or
That's the
saline.
next question. Yep.
The shells are all silicone and are made up of heavy metals and solvents and benzene and a lot of if you look up benzene poisoning and a lot of the symptoms women have with breast implants, they're almost identical.
Wow.
So when you are, I this is the best analogy I can give you, and that should make perfect sense to women, because we've all been told now to not drink water out of a plastic water bottle that has been sitting in a hot
For
car.
sure.
But if you get in that hot car and you pick up that water bottle, it might be a little more moldable, but it's not melted. I mean, the plastic's not melted. It's still a closed and sealed bottle. But we know from testing on the water that microscopically, the chemicals from the bottle have leached into that water. So when women are regularly getting in the sauna every single day and heating up their entire body, we know that at the 8-year mark, implants begin to degrade. The rupture rate goes up by 0.5% a
Oh,
year. So if something's
at
at
the
the
8 year
8-year
mark.
mark,
Okay.
yes.
Wow.
So if something's degrading, where is it going if it's inside your body?
Right.
And if you are heating up that implant shell, then common sense says that you are increasing the degradation of that shell. So I the way that, without saying more
Right.
than I can without getting in
Yeah.
trouble,
Yeah.
the women that I have worked with who regularly got in saunas with implants and had these very high levels on their toxicity tests, and then who had explant surgery, and 3 months later do another total toxicity test, and suddenly none of those chemicals are observable in their test. What happened?
Right.
What happened? So it's and it only makes sense as to why things like suddenly my liver enzymes improve. Like, why would that happen if there wasn't some chemical component going on? My implants were 8 years old, you know? So anyways, I have just seen so many women who get in saunas who are sauning all the time with their implants and they're suddenly getting rashes on their body. They're
Wow.
gaining weight. They're feeling worse. They're super tired after they
That
get
was
out of
a
it.
very popular question. What would the signs be if I am somebody that has implants and is using a sauna? What are some of the signs? So
Yes.
rashes, what else?
Rashes, weight gain, feeling worse. A lot of times women will get much more tired after, and I'm seeing all of these comments: hot yoga, baths,
Hot
jacuzzi.
tubs.
Yes, all of them. So women are like, "Well, does it mean I can't take a hot bath?" No, just don't submerge your breasts. Um, Short baths is
Yeah.
what I always tell them for a while. Um, just because if you're already experiencing symptoms, you're most likely going to increase your symptoms. Again, this has just been my experience with
Right.
having literally worked with hundreds up to maybe 1,000 women at this point and seeing the same thing over and over. Unfortunately, we are the study, and all I can do is
Right.
like look at the evidence of what I see with the women that I work with. And then when I tell them, okay, stop getting in the sauna and just save the sauna, you're going to use the sauna like crazy after explant surgery. You got to wait until the 6 to 8 week mark, but it's going to be a huge part of your detox process because a lot of those chemicals are water based. So like you're able to really
Yeah.
sweat using binders and different things and really get that out. That is what took my you tend to plateau if you're not doing anything for detox after explant surgery. You'll get to a certain point and be like, nothing, the needle's not moving anymore. And then when you implement things like sauna or coffee enemas or different things like that, that's where the needle starts to move again. But yeah, it's just an increase in symptoms. Rashes is just such a, weirdly enough, rashes on their legs
Whoa.
is where they tend to get the most rashes from doing sauna with implants. Um, and just, yeah, not feeling great. And then afterwards, after they're several months out and they've been doing saunas again, they're like, I feel amazing after I do sauna. I never felt like this before.
Yeah.
So,
Yeah.
yeah,
That's honestly, it's insane to me because again, we're just trying to incorporate more tools into our wellness routine,
of course.
doing
Yeah.
things to just improve how we feel. Of course, our hormones are changing when we're in perimenopause, but yet like there's these conversations are missing where, some of these things might not be like the best thing to do right now, especially.
No, and heavy detoxes are not a good idea
Oh,
when you have breast implants. You can make women a lot sicker. And I've had so many women that are like, I'm working with like these really great functional practitioners, and they're having me do heavy metal. One of the wildest things that I've seen is that again, that just further proves this is not what you should be doing, and that heavy metal detoxes work, but that they have all these heavy metals. They run these chelation,
yes.
therapies, and certain metals go down, but the metals that are implants all shoot up because they're literally pulling it out of the implant. It's crazy. So and then these doctors are like, I don't understand it.
Right.
Where did all these metals come
Right.
from? And so yeah, and the women don't feel better, they feel worse after doing
Mm-hmm.
these heavy detoxes. So it's really just finding ways to, you know quiet the inflammation as much as possible
Mm-hmm.
through nutrition, through trying to reduce your stress, through you know PMF, any of the things that you can do that are going to just like try to calm your central nervous system. That's what you're focused on.
Yeah.
And yeah, and save the detoxing and the saunas and those things for after.
Yes, I couldn't agree more because there's so many practitioners, I get a lot of patients that have done a detox cleanse protocol and it just wasn't a proper bind and eliminate
Yeah.
scenario, impacted, or I should say like further complicated by the fact that they have implants and feeling like worse, 10x
Oh
worse,
yeah.
not able to
Oh yeah.
function. And oh, it's the cleanse. It's like, no, it's just the lack of the conversation of, well, maybe we shouldn't be binding and eliminating anything if you have a device in your body. Yeah.
Correct. Correct.
Yeah. So
Yeah.
Candice, how can people in the community, do you have a space for people to come and like access some of these resources you're talking about?
Yeah. So I have a lot of information on my Instagram. I try to just put up reels that are tidbits of educational content based on what I've learned as working as a patient advocate and working with women privately and working with
Yeah.
surgeons. And then I also have a website, holisticolife.com, where I have other resources for everything from looking for an explant surgeon. I don't have a surgeon's list on
Okay.
there. That is something that I work privately with women on because
Perfect.
there's a couple of reasons. One, that's very individual. Some women, depending on their symptoms, what they're looking for, are they wanting a lift? Are they wanting explant only? How important it is for their emotional state, matching them with the right surgeons is
Yeah.
very important. So it's not just like, hey, these are all the best surgeons. And also, surgeons' work changes. And so if I have, start hearing certain things like, my experience wasn't that great with this surgeon, and I start hearing that more often, even though I know it's a surgeon that's performing proper explant, it's all aspects of the entire explant journey is really important to me. And so I won't be referring to those surgeons. And that's why I can't just keep a list up.
Yeah.
So,
No,
but
that's perfectly said and really important because obviously consistency matters.
right,
Results matter.
exactly, exactly. And surgeons, like everybody, can get tired, maybe tired of their job. I don't
Yeah.
know, but
Yes.
there's and things change, and so there's that. And then I have a list of questions that are really important to ask explant surgeons or surgeons when you are starting consultation process, and with the answers, because it's
Perfect.
important to know, like, this is what they
Yeah.
should say, this is what you should ask, this is what they should say. So
No, that's
yeah,
good.
that's
I mean, that's it's helpful because especially if somebody's just starting this journey out, I mean, you could probably eliminate a lot of what I went through because I was creating sort of my own hit list. Every
right,
consult I did, I was like, I didn't like the way they answered that, or I should have
right.
asked that. So that's an amazing resource.
Yeah, yeah. It's so hard, and women get this. It's most of the time we've been to so many doctors by the time we're finally getting in front of a surgeon, and we have so much riding on it that our minds go
Yeah,
blank, or we're intimidated because this is a surgeon you've seen everywhere, and they are Instagram famous, and so there's just different things that
yes,
factor in, and I just see women like go, I can't remember. And if they didn't have a list, if they didn't write a list and bring in their questions, then they feel like they didn't get as much out of their consultation. And oftentimes you're paying for a consultation.
right.
And I encourage women to always meet with ideally three surgeons. And I describe it like a dating process. I really feel that as long as they've checked all the boxes, which you can ask a lot of these questions to the patient coordinator, so before you're paying for a consultation that this surgeon checks all the boxes, they do all of these things correctly, but now it's time for me to meet them and feel like, is this really someone that I want to go through this next part of the journey with? Because
Yeah,
that's a really important thing, because you're going to be, you have post-ops, and you have
it's a long
issues
road.
that it's a long road. And surgery is surgery. There can be things that have to be revised, or issues with healing, and you want to make
Yes.
sure that you have someone that's really going to be in it with you and wants the best results for you from day
Yes.
one. Yeah.
That's awesome. Well, listen, I want everyone to go follow you, check out Candice's link and her story highlights for extra resources. Definitely, when we post this to the feed, please feel free if you want to leave a comment for Candice. She can jump in within reason if it's not something that's completely, out of scope. And I just can't thank you enough for this conversation, my love, because this is such an important. I didn't realize when I had posted about implants and saunas that it would be that heavy and get that much
Yeah.
traction. So I'm really glad that you were open to having this conversation and clearing up a lot of the misconceptions.
Yeah. Absolutely. Well, thank you for having me
Yes.
on. And
Thank you so
I
much.
want any of my people who are following to
Yeah.
definitely follow you, because we are all, most of us are all in our 40s and navigating this
Yes.
next chapter. And you are such a great resource.
Oh,
So
love you so much.
love you.
Thank you so much, everyone.
All right. Bye bye.